Hello friends, this is your nurse Gladys. So today I'm going to just take you through the preparation of central line insertion. So I'm preparing for that procedure. So these are the things that I'm going to need and we're going to use it. So I'm just going to be showing you item by item and what is used for. Basically we have iodine, we need it to clean the area, and by the way it's a sterile procedure, so we need iodine to swab and clean the area. Then we have 2 packs of gauze. They're here. We're going to need it for swabbing the area to make it sterile. Yeah, these are sterile. These are sterile. The outside part is not sterile, but when you open, the inside one is sterile. So we need normal saline. So when we are using the central line, we first pick some saline in a syringe, and we try to probe to see if the central line is parting. So that's why we need it. Then we need a syringe definitely to see. We're going to get some saline in and try to probe this to see if it is parting. That's why we need that. Then we also have this 20-ml syringe. When we insert the central line inside the patient, we are going to get some blood and put it in these culture bottles. So this is aerobic and anaerobic. So basically we use 8 to 10 mils, and also this is 8 to 10 mils of blood. So basically we need this because we have to culture the patient's blood to know if the patient has some resistance to some antibiotic, and yeah, we treat accordingly. Those are the things. Then there is this is the central line itself. This is size 7. It's an adult. It's what we are going to insert. Central line basically helps us not to every time be popping the patient like to pray. It's going to be there like about 14 days, depending on the days of the patient that the patient is staying in the hospital. But it really helps the nurses and the doctors not to prick, and also it helps the patient because it's really painful to every time change cannula here and there on you. Yeah. Then another thing that we need is this. This is the STL set. It is just basically it's a sterile one. The instrument in is used during the procedure. Then if the patient had a previous central line, basically most of the time we remove that, take off the tip and take it for culture also. That's why we have this. Then we have surgical gloves that the doctor is going to use, and an assistant. They will be put donning on that because it's a sterile procedure. Then we have this Primapose that we're going to, after inserting the central line, we're going to put this Primapose. Yeah. We're going to put this Primapose to cover it up. Then we have nylon 20. This is basically just after the doctor inserting the central line in, is going to stitch it on the patient's skin and get it there, not to let it